All right. Well, welcome everyone. As the host of our Zoom room, this is an urgent emergency assembly of all of us here tonight. But what I hope is that we can build a cannabis clinicians, patients and providers coalition, because we're not. Yeah. Okay. So Dale's back. We're not going to not be voicing our opinions and our voice on what needs to happen for patients and for providers, to keep access to this sacred plant in all forms. And so, tonight is really a kickoff. It's a little late, so I appreciate your participation at this late hour. I know we've all had a full day. But I want to kick it off and really just talk about, we're here to discuss what to do about AB 2223 and how that's going to impact patients and providers across California, and our livelihoods, and really help hurting access to full spectrum CBD and minor cannabinoids, and the access points that patients have them available to them through right now, and how that's going to change significantly should this legislation pass. So with that, Megan, Chella.
Can you folks hear me, by the way?
Yes, we can.
Okay, I'm Dale Geringer with California Normal. I have a message directly from the sponsors of the bill on how you could best act to affect matters. So whenever you want to hear that presentation, I'll let you know. But you're going to have to contact the sponsors of the bill and the governor, and you're going to have a very concrete proposal on hand that can pave out a very narrow exemption for specifically the kinds of medicines this group is concerned about. And if you got that, we can forward it to the author's office and to the governor's office and the sponsor's office. We have about August 6th.
So yeah, and we'll come back to you soon, because that will what can we do about this, right? So let's go to Bonnie first, who has got the floor.
Okay, so thank you everybody for being concerned about this. I know I am, and I understand everybody else has a stake somewhere here, and we all have to figure out the best way to move forward. So a couple of things. As you know, I put out a petition, and it's on change.org, so please share that with everybody. I was invited by Paige Figge, who is the mother of Charlotte from Charlotte's Web, to go with her to Sacramento last week. And just to give you an update, I went and spoke with legislators, the DCC, the governor's office, this bill sponsor, all day Tuesday and all day Wednesday. We also had a parent of a disabled child with a severe genetic syndrome with us, who shared her story and why this would be catastrophic for her child. There was a proposal that children can use the Epidiolex instead, just get it prescribed, and we explained why that's not an option for the vast majority of children and adults. The cost of it, the efficacy and side effects and high doses that are needed versus full plant, or full spectrum cannabis or CBD. We also explained why it is difficult to have the similar products in a dispensary with high concentrations, with affordability. We all know that when you go into a dispensary, I think I've seen the most I've seen in a bottle of CBD is 1,000 milligrams. And there are people who that's their daily dose, or even double that as their daily dose. So that does not work when those bottles are about $80, and you multiply that by 30 days and then by 12 months, and you're talking about $35,000 a year versus under $10,000 for the vast majority of patients if they're buying their products. The other thing we explained is that sick people, someone getting chemotherapy, someone with a seizure disorder may not be able to get to a dispensary physically. And that although delivery exists, the delivery near you may not have the product that you need because everybody is sensitive to the particular genetics of the plant. We also explained that even with a very big compassionate care discount from a dispensary, that the cost of the oil would be unaffordable for the vast majority of people because there's so much taxes in addition. And that we also explained that many of the companies that provide good quality, clean hemp, we all know what I'm talking about, in the high ratios, high CBD, low THC, often give disabled seniors, veterans, low income discounts. And that doesn't always appear at the dispensaries. So we have we made our case on all of those. To sum up what Dale mentioned, and thank you, Dale, for bringing it up, that it needs to be a clear solution. We can't just yell and say we don't want this. We have to give a solution. And the solution that has been worked out in other states, don't know if you're familiar, but in Virginia and in Colorado. Now, of course, Florida just vetoed everything, so they still have Delta 8 available. They still have the hemp the good hemp that we're talking about available, but they're still going to have regulation issues there. But Colorado and Virginia both had similar issues and passed laws or with an amendment that said high CBD, low THC, naturally occurring full spectrum was carved out. And the ratio was I think one state is 15-1 and one is 20-1. And I'm sorry, I don't remember which state is which. Sorry about that. So I was there representing consumers. Paige Figge was representing her federal nonprofit, which is fighting, for the feds to help us with CBD rather than not regulating anything, but getting involved. And what worked in these other states, again, was a cap of something like 1.5 milligram. I can't remember if what served per serving or per container, or CBD to THC ratio, like a 15-1 or higher. We all know nobody is buying a $200 bottle of CBD to get stoned, right? You'd have to drink the whole bottle and it's a lot of money and you'd go broke before you'd really have your jollies. So anyway, so that's the summary. That's what I've learned. Today, I got a message saying to chill out and it's okay. No, it was a good message to chill out. And it appears that maybe they've heard our voices and they're working on this particular solution. And that's the information that I have. I don't know if anybody else has more information, but what I learned, I have to share with you. I'm not good at politics at all. But what I learned is that everybody really does care. They listened to us. They took notes. They wanted to hear from the mom. Nobody brushed us off. Nobody rolled their eyes and nobody gave us any grief. They listened. And I was really I felt very privileged to be able to take the time. I wasn't like rushed in and out in 5 minutes. They took the time. Everybody gave us at least a half hour so we could cover all these topics. And so I just want to put out there, that it seems that they're willing to work with us and to try to carve out. Now, that being said, I have no idea what's going to happen, but I feel like at least the voice was heard. It's now as they say, the ball's in their court.
Well, that's comforting news, and I'm glad to hear that. So Dale has his hand raised. So
yeah. So Bonnie, for who in specific were you talking to that gave you this encouraging reception?
You're on mute, Bonnie.
Sorry about that. We spoke to the 3 people from the governor's office.
Like who? Do you remember?
Angela, Jamie, and somebody else. Don't ask me last names, Dale.
Not Angela Baca.
Angela, who is the one who helped with AB 45.
Okay. I don't know. Okay. Angela, Jamie, and somebody else.
With Nicole Elliott's right hand from the DCC.
Who did she send?
Angela. She's a deputy.
And Angela Baca, that's in, yeah.
Oh, okay,
Or
yeah.
not
There's
Baca.
there's two Angelas. One
Yeah,
from
okay,
the
got
and
it.
one
Yes,
from the governor's office. We met with Assemblywoman Aguiar Curry, who was
okay.
lovely and
Yes, she is.
heard us and listened. And in fact, we were carved out for a half hour and she gave us 45 minutes because we were long-winded. And her staff was in the room and her staff was lovely and listened to us and even talked to us afterwards. And then we talked to a whole bunch of other legislators, some state senators. I can get you the list, Dale, because I can't
That-
remember. I know
That's
Eggman.
good. You've done
Yeah.
a lot of
Yeah.
that's the kind of spade work you need to do. I had a question about the particular recommendations you were making for like 15-to-1 potency or
15-to-1 ratio CBD to THC.
yeah.
Because if somebody needs a higher dose of CBD and that THC comes along, we know that's medicinal, right? If we go up on the CBD and we cap the THC down here, the ratio changes. It's no longer a 20-to-1, it's then a 2,000-to-1 or a 6,000-to-1.
Right, I understand.
Right, so they seemed
But
open to that, and I explained that the vast majority of my patients, even though there's a range, many of them are 20-to-1 to 30-to-1. That seems like the sweet spot. The studies from Israel on epilepsy and autism use 20-to-1, right? And we know that if somebody needs a lower ratio, luckily in California, even though right now products are hard to find, you could get some THC added in and create your own lower ratio if you needed to. So anyway, go ahead, Dale.
Then is there anything you could say about the particular formulations that you're using? I mean, the issue with the governor is let's not confuse this with a drink that gets sold at convenience stores that also has 15-to-1, but actually you can scale that up to the point where you can get like 5 milligrams of THC in there. So
sure. So it's in olive oil or MCT oil.
So
and
in oil.
Thick as a dog if you drink the whole bottle, if you use it as a drink. You would have to take a big fat dose because although there are some studies showing that sometimes CBD makes THC hang around longer, we're just not seeing intoxication with these products. These are not the products that people are calling poison control about. And most people, if they were to drink a bottle of oil, their tummy hurts. And, it's just not, it's in oil. It's not in yummy lemonade or.
So is everybody else in this conversation here on this call also using formulations that are oil based as opposed to like gummies or something like that?
Combination. Just
Combination
of oils, gummies, capsules, and topical.
all of it.
Okay.
But none of them is anybody using anything lower than a 15-to-1 from a hemp line?
No.
No.
No. Everything is like at least a 15-to-1 or higher, because that's what hemp does, right? So, I mean, Dale, you know that.
Right. I'm just trying to calculate in my head whether just giving the 15-to-1 is enough instructions to define what probably there's a minimum potency in the first place, right? The minimum dosage that you were talking about.
Well,
that
people
doesn't
can
matter.
in terms of dosage, what we find, of course, and I think you know this, the range is very wide, and there's people taking 50 milligrams a day and people taking, 1,500 milligrams a day.
Right.
Gummies are not going to be the way to go if you're a really high dose, because you'd have to eat, again, nobody's eating 30 gummies. So I think when we're talking about the oils in general, and again, people out there, you tell me, because I don't know everybody's products, but in general, we're talking about 25 milligrams in 1 ml of CBD or 50 milligrams. In the dispensaries, the highest I've seen is like a 30 milligram in 1 ml, but it's usually 1,000 milligrams of CBD. And and if it's got, 30 milligrams, right? So it's like a 30-to-1 ratio, something like that, right? But in general, in my experience, anybody who's needing high doses taking the oils or, yeah, right? I mean, yes, I think everybody here is in agreement, right? Not too many people using the gummies in big doses. The most I've seen in a gummy is like a 30-to-1 ratio with 25 milligrams in it, and that's even hard to come by. Usually the gummy
Right.
is much lower dose, right? Is
So,
everybody
so,
agree?
so these things that when your patients purchase one of these products, what typically is the content of that
Okay.
product?
Okay, so vast majority of patients are buying a bottle with 750 to 6,000 milligrams of CBD, usually in ratios of 20-to-1 up to 30-to-1, somewhere around there. I have some patients that need a 50-to-1 who are sensitive to THC. That's my experience. I find in that range seems to be the best range of dosing for kids with autism. Of course, we sometimes have to go lower on epilepsy too, but usually that's I'm adding in THC separate so the parent can titrate and do it in a very methodical way. If somebody needs a 1-to-1 or a 4-to-1, even a 10-to-1, they're buying that at a dispensary. Doesn't seem to
Right,
be
okay,
on the hemp market.
that'll still be there.
Yeah.
Okay, and how many people actually are getting this from out of state?
Yeah, many patients are buying, like, remember that one of the first companies, and again, I'm not endorsing anybody here, but or that I'm going to mention, this is just what I see. Remember, so there were a handful of companies that started this in 2013. Charlotte's Web is the most famous one. There's a lot of people that use their products. They are like, the gorilla in the room. And many people who started with their products and their products work stuck with them. So they're out of state. They're from Colorado. Other companies started in California and have moved elsewhere. I have patients that buy oil from Kentucky, Tennessee, Nevada, Oregon, Colorado. There's probably other places, but those where I have many patients that buy their oils from out of state. And it would, again, they're terrified that they won't be able to get that, especially if the company says, well, we're a big company, we're not going to ship to California because we're not compliant with their regulations. That will cut off a lot of people from their products. Now, there are a lot of really good products in California, but everybody, I have patients that have to try 5 different oils before they hit on the right one. This is not unusual in this refractory type of population that I treat.
I'm just saying this group, of course, in the worst case,
Right.
and none of this is accommodated, you can be able to buy the stuff from out of state and there's nobody going to stop it. Frankly, they can't enforce that.
Well, that's the
But
reality.
I mean, we don't want to do that.
Right, right. Nobody wants to be a criminal, especially since they're not criminals today using their oil today. And why it should be taken away is really, one of the things that a parent wrote to me was it's just an injustice and it's just not okay to take away. And it's unethical and immoral for me as a physician to tell a parent, stop using the oil that works for your child and use something else. That's just not something I'm going to do, because why would I have parents who have not seen a seizure in 3 years, and then, something happens and they see a seizure, and it is like the most traumatic thing that they've ever been through, because they just got 3 years of like not having to live like that. And it's just really important that we try to protect this.
Absolutely. So Healer, you have the
Yes.
hand up.
Hi, Bonnie. It's Michael Foyer.
Yeah.
Couple of quick questions for you. When you met with the people at the Capitol, was this on the record, and did you leave any written testimony with them, or how was it structured?
Yeah, so I don't know if you guys saw the LA Times article, so that was left with them. And then we also left with them a letter from Paige Figge's organization, basically stating that this is what was done in Virginia, and this is what was done in Colorado, and this is what can be done in California. And that carve out, basically, we did leave. Basically, I forget how you say it, Dale, maybe you can help me, where you're for the bill with an amendment.
Yeah, I support if amended. That's how you
Support if
state that.
amended, and that's what we
Yes.
said. that we support if amended. And we gave them that one piece, that sentence basically, that gave a max. Now, just so everybody knows, Ryan Vandry, who is a professor at Johns Hopkins, he's a PhD. He is like one of the leading cannabinoid, like abuse liability researchers in our country. And he wrote an article that wrote a letter that was also submitted to the state. His research showed that for acute intoxication, it's really a 20-to-1 ratio. It's 100 milligrams of, he tested different amounts of THC with 100 milligrams of CBD. And he found around 3.8 milligrams of THC might cause somebody acute intoxication if they took it with 100 milligrams of CBD. And that's where that milligrams comes from. I would prefer if they just didn't put a cap on the milligrams, but I would prefer if they just got rid of the synthetics. That's my own personal feeling, just
Same.
because there are dangerous other compounds in there. Not everybody is a chemist who's making these, and I think that it gets a little scary, but
So
yeah.
it
Go
might
ahead,
be
Dale.
possible to specify natural extracts in this to
I
narrow
would
it.
like, I personally would like it to be natural. When I was in Sacramento, it was hard to teach everybody everything about this, all of this, because it's nuanced, right? It's not just lump all hemp together. So we were kind of calling it recreational hemp because it's hemp that's been converted from CBD for recreational purposes. I mean, really, nobody's taking CBD for recreation. I haven't come across anybody in my practice or in my contacts. I see everybody shaking their head. So, you know, the amount, the THC limit was bandied about like between 1.5 and 3.8, somewhere in there, if you're going to cap it. And I'm sorry, I can't remember if we were talking about, I think it might have been per container, per serving. And look, we all know that the synthetic stuff is harming our licensed, regulated dispensaries. And all of us want these dispensaries to exist. This is where our patients get their other medicine.
Mhm.
So, you know, one of the things that I did not get to convey is just how dangerous I think the synthetics are. We don't even know what to test for. If you read the literature, there's novel things being made that have no toxicology in humans. And we're seeing in the literature psychosis and mania. And there's a case of visual snow. If you guys saw that publication where somebody now can't see because of their whatever. And it seems to be more from vaping. But while I was in Sacramento, as well as talking to people elsewhere, people have told me that they've tried these unregulated products and had very bad experiences. So, yeah. So the language I think we had, our stance was 1.5 milligrams. I would have liked it to be a little bit higher, but there was like a consensus that we had to come to. So
One
it's
point-
dose, per
What-
dose.
Per serving,
per serving, okay, per serving, and it's, right, per serving, or the carve out for the higher ratio. It's not both together,
which
understand?
would
Or
be about a 30-to-1 ratio if you have 1.5 with 100 milligrams of CBD or so, right? It's about 100, and all of us could get behind that. We can't get behind 1.5 per container. That won't work.
Right. No, I think it's per serving. You're right. Yeah, per serving. And the other part of that too is that like when I've seen these products with Delta 8 and whatnot, they have like 1,000 milligrams in them. I mean, it's crazy how high, right? If you look at some of the labels.
Exactly. And Dale, to your point, all of us want to ban those. There's no
No,
reason
the-
that
the-
anybody in this room who's a practicing clinician or a patient wants anything to do with these synthetic Frankenstein types
Yeah.
of cannabinoids. That's
well,
not
that's the rationale behind this bill. They basically want to,
throwing the baby out with the bathwater.
yeah, but it's going to take a while. And I don't know if you're aware, but there are amendments that that have not appeared yet publicly, that the advocates, sponsors with CCIA and Amy Jenkins. Have you talked to Amy Jenkins at CCIA? Well, I can
I've
forward.
spoken to Amy Jenkins.
Okay, so she's out there. Okay, and she's been talking to the governor's office, and they have been negotiating massive amendments. The basic thrust of which is going to be to take all of the hemp products out there and eventually move them over to the licensed cannabis system with the same standards for testing, basically. But it will take, whatever they do, will take at least a couple years to implement. And in the meantime, they're really going to crack down on these illegal hemp products in California. So it's important to have a carve out to protect us for these 2 years. And I think you made a very savvy appeal there, Bonnie, and we'll follow up on it. I'm just trying to think of the best way. I'll look up the Colorado and the Virginia language, and because if I can, it's always helpful to point to that.
And one thing to share is that this was instituted in Colorado last year, and it is working. They are cracking down on on the Delta 8 companies, and they have a fine of $10,000 a day for every day that the product is still on the shelf. And they're supposedly going to be using that money for enforcement, so it doesn't cost more. There is going to be some fines, and hopefully that would help fund enforcement. So it doesn't have to be money coming out of the state budget, I suppose, which is not a bad thing.
Well, there's been no money for enforcement in California's. It's the Department of Public Health, and they were hoping to make money off of registrations, because you have to register to sell hemp products in California, theoretically, if you bother. But the registrations are not contributing enough money for them to do an enforcement program. So, but I think the governor wants to solve that somehow. But he's planning a trailer bill, so-called, which will have all of this language in it, worked out in consultation with Aguiar Curry's office and with Amy Jenkins at CCIA, and
who's
the governor's office is the most difficult
nobody's
one to deal with.
representing patients at all.
Who's
Nobody.
representing patients, Dale?
Well, you are. You were just there.
Okay, right. Well, I was there, and I'm hoping that they understand that. I mean, I don't.
We're Cal Normal is also a recognized consumer group, and we represent patients. And tomorrow we are going to be in Sacramento with a bill that we're sponsoring to make sure that cannabis donation programs remain on the books in California and don't get terminated. So we're proud to be doing that tomorrow in Sacramento.
So Dale, is does there need to be more? Like I've been kind of told, just like give it a chance because they're working on it right now.
Sure. Okay. Well, that's good to know.
But I have a question about 2 years. So is there a possibility that they're going to put in, I guess there's a possibility for anything now that I think about it. They could put in, we are allowing the 20-to-1 carve out for 2 years, and by 2027 or whatever, all hemp products will have to go through a dispensary, because then again, it creates a problem. How do companies that are not here in California?
I don't know.
Yeah.
I really don't know. And only the governor does.
Okay.
So Bonnie, I can share with you our experience in Maine. So there was similar legislation proposed earlier this year, and we opposed it in Maine and went to the Capitol in Maine and met with the legislature there several times. And Dustin went and presented, and we had written materials and testimony that we gave live. And we were able to postpone. They tabled it, so it wasn't even, didn't move forward. One of the things that we found very successful was to be able to talk to the individual legislators, and especially the individuals who are proposing the legislation, and sharing with them that safety is a common goal for everybody. And once they understood that, we were able to actually move forward with common language that we were proposing that they then understood would help with the stated goal of safety and helping the public. And so we were, I think, very effective in doing that. So if there's anything that we can do to help you as you do this in California, I'll let you know that Healer and myself, I'm happy to help if you need help putting together written testimony or anything else along those lines. I don't know where you guys are in the procedural process, but once you have an understanding of that, please let me know, keep me informed, and I'm happy to help in whatever way we can.
Thank you, Michael. My understanding is language is going to come out sometime by the end of this week, but I don't know if that's just, again.
Okay, there's going to be some language that's going to be released, but it's not going to be the final language because the governor's going to come in with some more stuff that's later on, sometime before August, I think 4th or something like that. So that's my understanding of the process here. But is
it still in committee or has it gotten out of committee?
It got out of committee yesterday with a lot of comments. I mean, some people wanted higher THC limits. Some wanted no THC limits at all. A lot of people wanting to find some sort of a golden mean there. And it is going, I guess, probably this is the last committee. It'll be Appropriations Committee, which is...
No, I must interrupt.
What?
Next week, it's going to the Health Committee, sir.
Oh, okay, good. All right, I haven't been following.
Right, on July 3rd. On July 3rd, it's going to the Senate Health Committee.
Okay, so the
Which
Health
means
Committee.
Tomorrow, we have to submit our testimony before noon tomorrow to the link that I put in the chat that also I'm sure Elizabeth has put in the chat as well. But we have to submit our testimony through that portal before noon tomorrow in order for it to be part of the consideration in the committee.
So this could be considered next week?
July 3rd.
Yes,
Dale.
sir. July 3rd.
Okay, okay, that's why, yes. Okay, that makes sense to me. Okay, Health Committee. Well, that's good.
The Senate Health Committee, yeah.
Right. Don't count on the amendments being there yet. I mean, I've seen these before, these political backdoor deals often, spill over beyond the expected agendas, but the deadline is definitely, the word is they want to finish it after the summer break. And I think the summer break is in July or something like that. So the final deal has
July 4th and we come back on August 5th.
There you go. So that's when they're expecting the final deal to be released from the governor's office.
Have they scheduled public hearings yet?
Yeah, there were public hearings yesterday. It's been through the
additional
assembly.
ones for the committee starting next week.
What do you mean?
Wait, I'm sorry, there are public hearings? I would love to be.
That's why I'm asking.
It's just health committee hearings. The proponents will present, there will be two proponents who will present the bill, and then, opponents can maybe put in a word or two. And, mostly it's like Me Too kind of testimony. We support this bill, or we oppose it with reservations or recommendations to improve it, or something like that, like a sentence or so. But it would be better to get in contact with the committee before that. And Charles is right that if you want to get in position letters to the committee, you better do it like tomorrow.
So I submitted a letter already at that link, so I don't need to do another one.
No.
Okay.
It was to the health committee or something. You wrote the letter.
I wrote it to Chalra. Do you know who that is, Dale?
Chalra.
Chalra.
Oh.
I would submit it through the portal
Yeah, you
Dr.
put it
Bonnie,
through
and
the
also the
portal.
I did
petition.
it through the portal, but that was the
Yeah,
name I was given to address.
Okay,
it.
okay. I think I haven't been to the health committee this year. He may be chair. He's really pro pot, by the way. So that's good. Um,
Ash Kalra's not on the committee though.
well then, okay, I don't have the committee list here. Do you have a committee list here, Chella?
Well, I submitted it in an email to a number of people, but Ash Kalra's not on it. Senator Roth is on it. I can look it up. I'll get it in a minute. I'll come
Oh,
back.
this is in the Senate anyhow. Yeah, Ash is in the Assembly.
Yeah, and it's the Senate Health Committee. Hang on. Oh, there, somebody's
very
pulling it
good.
up. Thank you so much. Go to the members and we can see all the members. Chairman is Roth, and a number of the senators on that committee are Southern California senators.
Let me see. Where's the names? Roth is good. Is generally a reasonable guy. He's a good guy.
Members, there they are. Yeah, Roth.
No, she's no good. Stephen Glaze is a reasonable guy. From Lena Gonzalez. Okay. Shannon Grove is a Republican. Probably maybe bad. Melissa Hurtado.
Might be good though.
Monique Limon. Carolyn Menjivar is a little tough on pot. Susan
Lola
Rubio.
Smallwood
She's-
Cuevas office had a problem with it too.
She did.
And
What was it? Do you
Wiener,
know
yeah.
what were their problems? They're important.
They said that they were concerned about the same medical concerns we had. I called them on Friday before I left, and Wiener is a psychedelics advocate. So maybe
you got a favorable reception from them.
yeah, I got a favorable reception from Roth's office. The other lady, Summer Cuevas, and one other person had concerns about the medical issues related to CBD, like we are all talking about tonight. That we want this carve out for CBD oil tinctures, gel caps, capsules, suppositories, topicals, things that are medical, not,
Okay,
certain.
there's a question about gummies here, because the gummies are the one thing that sort of be construed as, candies or edibles.
It's on the bubble. It's on the bubble. It's true. My concern about gummies, my only concern is I happen to know a wonderful company, Healer, who has recently made a blister pack pill card with gummies for seniors in care facilities. And to me, this is extremely important because my loved ones have Alzheimer's disease and dementia and are in care facilities. And the Healer product is a hemp product and can be distributed in a care facility right now. And the most, and Michael, correct me if I'm wrong, but the most number of THC in the Healer gummies, it's 1-to-1 CBD THC, and I think is it 5 milligrams?
Yes.
Please, Michael. Yeah.
Oh,
Yes.
okay.
So,
that's clearly not the kind of thing they want to allow. I will tell you. I mean, the 5 milligrams is an intoxicating dose. I mean, that's a common starter dose is 5 milligrams of THC, and but you can get those very cheaply actually on the legal market. I just bought for like $14 20 gummies that had 5 milligrams of THC in them. So
sure. So listen to me about my concern, okay? My concern are old people with dementia in a care facility who are covered by Ryan's Law, poorly written law, that says that nurses are forbidden from helping people take this medicine.
yes.
They help them with literally every other medicine.
Yes.
That needs to be fixed next session. It needs to say not forbidden. A facility can certainly choose to do it or not, but it needs to be not forbidden. So my people, the people I most care about, the ones stuck in a care facility, geriatric jail, who can't get access to this affordably. Affordably is the key.
Mhm.
Well,
So I
said,
understand that the gummies are an issue. And listen, if gummies, I'm so sorry, everybody with gummies, if gummies have to be the thing on the chopping block, well, I mean, but if we can get all the other, because Dave, my husband, Dave, is 7 months seizure free right now, literally right now, like this week. 7 months seizure free because he takes 800 milligrams of full spectrum CBD from Oregon. That's third party tested. We love that. Everybody wants that. Everybody wants the organic. Everybody wants the clean hemp. Everybody's on board with putting hemp in the regulatory framework as far as requiring third party testing and it being clean. Everybody's totally cool with that. It's these THC caps that are hugely problematic because Dave, one capsule that Dave takes is 200 gel cap, 200 milligrams, and has 0.75 milligrams of THC. He takes 4 of those every day. He's not getting high from that, but he is seizure free from that. My dad with dementia takes 2 of them a day. He is not getting high from that. However, I do use regulated products, THC, to help with my dad's other problems. And I'm not talking about that. Of course, listen, the healer products, I would love them to be legal, of course. But listen, if that has to be the thing, fine. But you got to, normal has to stand up for health equity and medical discrimination. We have to pay out of pocket.
Yeah,
we have to
and
pay out of
there's
pocket. Dale, please. We have to pay out of pocket for this medicine. Number one, so it's only available to people who can afford it. Lazarus Naturals gives us a 65% off discount. So the $200 bottle of gel caps that Dave gets is $75 for us. No 40% tax, just normal sales tax. And it's delivered to our house. So Dale, this has to be preserved and Normal needs to stand up for us. Normal cannot ignore the least, most vulnerable patients.
We've never done that, and that's why I'm
out.
talking here anyhow. But we have very limited leverage over this bill. I mean, Normal per se has very limited leverage over the bill. However, I think Bonnie has a lot more leverage if she brings in patients and talks to the governor's office, and I think that's very encouraging. I want to do what I can to. What I'm going to do is I'm going to research the Colorado and Virginia laws and see how those work so we can come up with a nice, neat formula that will satisfy the governor's office because they're the tough ones in this. Okay.
Tell them it's health equity and medical discrimination.
Well,
use
it's politics
those words
too. So that's an important
Use
thing.
those words.
Yeah.
Health equity,
But
medical
remember,
discrimination.
so one thing for sure is that once we hear the language, I think then if the language is not what we want and it does continue to it creates a discrimination and what you're talking about, Chella, I think then we rally and we get hundreds of people to show up in Sacramento. I know it's not easy, but we've got people who will go. We can all go and there are families that will go and nobody wants to see people in wheelchairs saying that the governor is making a bad decision. They don't want that. They really don't. The man wants to be president. He doesn't want this ugliness. So I do think we have some, Dale, I know we don't have a huge amount of leverage, but we have some. I went to Sacramento saying we have to just separate these problems and just leave this alone. Don't even touch it. Don't give me caps. Don't give me a ratio. Just leave full spectrum naturally occurring hemp alone. But it appears that that is not something that is going to happen. So now we have to compromise. We have to play the game and come up with a way that is acceptable to patients. And I agree with you that if the gummy here and there has to be on the chopping block, that's okay, because they are not the most expensive products and people can spend an extra $1 or $2 if they have to. But it appears that there is no way to not compromise somewhere. It's
well, also, if am I not correct, that the gummies don't meet if we went with a 15-to-1 ratio, these gummies are not 15-to-1 CBD to THC. You were talking about more like 2-to-1, or weren't you about the gummies that are being used?
So my parents both use a Charlotte's Web gummy that is 10 milligrams and it's a ratio of about a 30-to-1, but it's only 10 milligrams.
Okay.
So the amount of THC is negligible, really.
Yeah.
And there are other gummies on the market, but again, they're not being used, they are not being used for the most, I hate to divide the way people feel, but in turn, like the most medically complex critical patients who rely on these
Yeah.
products. I don't
So
know if
it's-
that's everybody else's experience too.
And part of the issue is accessibility, right? Being able to ship via mail as opposed to sending seniors out to dispensaries. And at Bloomham, we do carry a 50-to-1. It's our T65 gummy. So 50 milligrams CBD, 5 milligrams CBG, 5 milligrams CBN, and 5 milligrams THC. It's a powerhouse of a gummy. And we start people with half of a gummy. It's very therapeutic and very effective. We could
What
cut that
market?
formula.
What
Pardon?
market is that being sold in?
It's from Bloomhound. So we're shipping. So we run the business from California, but they
Oh,
ship
right,
from
okay.
Colorado
Yeah.
to all 50 states. And that's legal right now. And you know, but we could cut that formulation. If it could be 2.5, that would be a compromise, right? But we're with you as well on the gummies. If we don't
And,
have to
and
have
we at Healer are the same.
Yeah.
We agree.
yeah,
Um, Is anybody using like glycerin instead of oil for their medicine these days? No glycerin. And alcohol, I know is not being used for, we don't have
There's-
tinctures out there, do we?
There's I think Healer, you have a tiny amount of alcohol to help with absorption, but it's a tiny amount, right, Michael?
A very small fraction, yes.
Yeah.
It's an ethanol extraction, so there's some.
But in general, Dale, most people are using olive oil,
Yep.
safflower oil, MCT oil, coconut oil. That's the vast majority of products.
Right, okay.
There might
So-
be a glycerin in the element apothic, which is a broad spectrum, but that doesn't have THC, so I guess that doesn't matter. Sorry, it's late. I'm tired.
That's okay. So anyway, I'm decided today to cool my jets and just wait and see what the language is. I'm talked to people. I've sent in my letter and I got the petition up and running and we're working on getting more people to sign the petition and Dale, I don't know what else to do. If you have any tips for us, I mean, I can only, yeah.
If you could send me a copy of your letter
Okay.
and I'll see what our lobbyists think and what would be a smart thing for you to do next. But I think you've done you've done the most important things. And yeah, be prepared to show up at the health committee meeting, I guess, if necessary. But we may have a
can't be there. I have a vacation
well, you don't have to be
scheduled next week, so I'm trying.
Okay, is there anybody here? Well, we'll see what we can do without having to have people there. Usually the decisions are made before the hearings actually, but sometimes it helps to have a good show of your supporters.
I offered up my email, my phone number to Assemblywoman Aguiar Curry's office to call me and ask me if they have any questions whatsoever about patient care, patient needs, the costs, how families are getting their medicine, just to reach out to me. I'd be more than happy to, and so we'll see what
Right.
happens, I guess.
We spoke with her office last week with a patient whose husband has stage 4 pancreatic cancer, and they were receptive. But it was the same day as the press conference that the CCIA held. My big problem, Dale, honestly, is the disingenuous way that this bill is being presented to Californians. Nobody is speaking publicly in the media, except for the LA Times article, thank goodness, for that. And, that foreign press article that you managed to get written. No other press is picking this up. Nobody knows that this is what's about to happen to their full spectrum CBD oil. Nobody knows that. It's a mystery. Everybody thinks it's just about this, save the children from the gummies and the sodas. And that's fine, except it also captures full spectrum CBD oil. And I know for a fact that the CCIA wants my business. They want the oils there.
No,
and that's
no,
why they want to do this.
They've got no Nobody's out to get you, Jella, or anybody
Honey,
else.
they're trying
People
to
are
get
trying
my
to
business. They're
survive.
dying.
There is
Yes,
one.
exactly. They're dying. They're dying.
Chella got an email that she shared, and I don't know if she shared it with you, Dale, from what appeared to be a dispensary owner, maybe, I'm not sure. who
Yes,
said-
she's dispensary owner,
Right,
Kim.
which, and I
did
understand
share it.
I understand their side, but
Mhm.
I think it's unethical and it's immoral
Yes.
and for us to put somebody's business and money above people's health, even though
Absolutely.
we live in the United States, where insurance companies do that all the time. Do we really want the cannabis industry to be like that?
Well,
And
let
I
me
personally don't.
explain one of the reasons that we early on, Cal Normal, early on, like 3 years ago, supported this general concept, which was to make CBD more available, more widely available in dispensaries, where I think there's far too much high THC stuff and you can hardly get CBD products. And this would make CBD products more affordable in dispensaries. I think would be beneficial if that were to occur. And as a consumer, I'm sorry that if I go to a dispensary, I can't get very good access to CBD products, and this would allow licensed products. So that is the pro-consumer side of this. And but what's really motivating it, of course, is all the irresponsible marketing of these psychoactive gummies and so forth on the product.
And Chella's right. This is the taxation. The fact that we didn't get a break for medical patients to have to not pay taxes. It is a crime that people have to pay 35% tax. And I will share with you that one of the more important people that I spoke with said, but patients don't pay tax. And I said, what world do you live on? What planet are you living on? Of course they pay tax. They pay the same tax unless they get the state card, and then they get maybe a 7 to 9% break on the tax, but they're still paying the 15% plus whatever city tax. And that was actually news to the person who is, to be frank, somebody important in this situation. And so it was like, okay, so, you know, the top doesn't know what's going on at the bottom here. And it's, yeah, the taxation is horrific, if you ask me. And that's certainly driving the underground market. There's no question, because any young person I know, if they got $100 in their pocket, they don't want to, they're going to go buy weed from their buddy and put the rest of the money in gas and food, and they're not going to pay the taxes. So.
Well, so you'll be happy to know, actually, that I had a conversation with Amy at CCIA just yesterday, and we agreed that we wanted to get a tax exemption for medical users next year, because taxes are going to be debated. The whole tax structure is going to be debated next year. And we want to get a medical exemption for medical in there for the first time. And the
like
great
Washington
difficulty.
State.
And here's the difficulty for you guys and everybody else to think about. How can we make sure that we have legitimate medical patients and we don't have this thing with pot docs online and shops down on Malibu selling Rex for $30 like happened before? How can we give the state some assurance that there isn't widespread abuse? So yes.
Yeah. This is how you do it. I'm happy to take a test, pass a test, and go on a list as a certified cannabis physician. And you have to pass a test because you know what the heck you're doing. Right. And you have to get in that test, you have to understand what the requirements are. You know, you make it so that people have to register. And if you're not on that registry, the patient's letter is not legitimate.
But any doc in the box.
Let me jump through a hoop. Go right ahead.
But unfortunately, that hoop is a very easy hoop to pass over. All of the doc in the boxes that I know of have doctors who actually know that shit, but they don't care. They just, issue recommendations automatically because,
So Dale, there's another way to do it. And the way to do it is to have no taxation on the medical products. Nobody's interested in buying a high CBD formulation with some minor cannabinoids in it on a rec market. So what my proposition is, and in my letter that I'm going to send to the health committee tonight, is to waive all taxation on a CBD formula with minor cannabinoids, so that there is no tax on these products that patients want. So that way, patients don't have to pay the extra expense to get the medical card. You can do both ways. You can have certifying providers like Bonnie that are going to attest to the truth in the system, and then you can also waive all taxation on medical formulations that the rec market doesn't want. And then the third part is increasing accessibility. Maybe if dispensaries had a product suite that was not taxed, then they'd start to create those medicines again, because you can't find good medicines in the dispensary chain anymore. A decade ago when I got into this, you could, but they're all gone. And you know, if somebody can find even RSO, a CBD, they can't guarantee that that's going to be reliable, consistent, standardized, and in supply chain. So what are the legislators going to do to create the marketplace that you dream of?
Well, I like the idea. I think of exempting CBD products is a good one. I think that's a doable one. There is talk about, you know, a THC tax versus a THC tax, and the CBD products don't get much of a tax. But yeah, that could work. But of course, there are a lot of people who are THC. Most of the patients, in fact, are THC users, and them we have to sort out.
Well, Dale, we didn't get anywhere trying to get any, the kind of the script mills to, you know,
Right.
do a better job with the 18, 19, and 20-year-olds, you know? So there's that little carve out of kids who are going and getting a $39 rec basically on an iPad for a 7-minute interaction, and then they can go in and buy whatever the heck they want. So that's just another issue. There's
That is the issue. We'd like to be able to somehow keep that out, keep that from happening.
Right. Well, in other states, if you're under 21, I mean, I hate to add this burden, because I wouldn't want this for my patients, that they make them get 2 recs. And I think that's ridiculous. They get a rec from one doctor and then they have to go pay for a rec from another doctor. And I don't think that's a great answer at all. And that to me just creates a mountain to climb for these families that are already struggling. So yeah, I wouldn't want that. But you know, I don't know what the answer is. I think Elizabeth has a great, that's a great, you know, medicinal products aren't taxed. That makes so much sense. And then the question becomes, who determines if they're medicinal or not? So then we have to figure out how that works. But, you know.
This coalition, we can work together with the governor's office to create a clinical corner. I've been talking about building the medical door for the past 5 to 7 years in a dispensary, where a clinical corner, these products are exempt from tax because they are medicinally focused.
Right.
And everybody in this room knows what's in that corner, right? We've got our capsules and our topicals and our tinctures, and we can have low potency gummies that will not get you high, but will make a difference when you need that 1 milligram.
Yeah.
For a senior that's not eating.
So that means we really want to revive, I think, the medical cannabis category that got lost in the whole the regulatory system. Originally was going to have like 2 tracks. There were going to be adult use and medical use for each of the steps along the chain, and basically the medical just sort of withered on the vine because everybody found it easier to do the adult use, and there is no distinction that's really meaningful now between them, because nobody really set out actual medicinal guidelines to say that no, bubble hashish is not a medicinal product or something like that.
And I also want to say that I have had dispensaries where I have called them and said, you're centrally located. Can you just carry this line of products? I've got parents all over around you that will come and buy the THC and will buy the THCA in the right ratios or the right preparations. And they said to me flat out, we can't afford to buy those because then they sit on the shelf and then they expire and we have to throw them out and we have a loss. And so the idea, again, And I'll just tell everybody, so I voted against the law in 2016 because I knew that this was going to happen. And
Me
I'm
too.
really unhappy with the taxation and the way that the two were going to get together. And I kept saying to myself, no, the medical program is robust in California. We've had it for 20 some odd years. And it took now 6 years for me to see that nobody's, again, in the licensed dispensary market, I do have patients that buy there. Absolutely. All my adult patients for sure, but my pediatric patients, they're mostly buying from the hemp market because that's where they can spend their money wisely and get the products that they want and so on. So I think it would be nice. It would have been better if medical had been separated from recreational, and maybe there wouldn't be as many medical dispensaries, but at least we know that the products would have been, I don't know, saved and carved out for these families. But there's a lot to do. Dale, I hope you didn't go anywhere, right? Don't go anywhere.
No, I think this is a multi-year project, actually
Yeah.
getting it fixed.
And we still have to work on kids getting medicine in school. Yes, the parents can go into the school, and the nurses now have come out and said that it is under their scope of practice.
Yes.
As a school nurse, they have accepted it, yes. But there is no law that protects them to dispense medication to the children, and so.
Same
So,
with the seniors,
Yeah, that's right. Same with seniors. That's right. And I have
the
patients.
people who are stuck.
Look, I just have a family right today who I talked to at Stanford University. Kid was hospitalized for a central line infection, and because she's 26, although she's disabled and kind of, she was still under the care of pediatrics, but there was a hospitalist that demanded them to stop their cannabis and even called Adult Protective Services on the mother.
Where
So-
was that?
Stanford.
Oh,
Stanford Hospital, Stanford University Medical Center.
my God.
Did you call
I have my
Eloise and
hand
tell her to
raised.
get down there?
I just heard about it today and it happened in January, February. I'm gonna look into it a little further, but really, really sad. And of course, the kid's having more seizures now and,
Of course.
Yeah,
And-
and Eloise works there in palliative care.
Right.
Yeah. Oh, yeah, no,
Yeah.
I know, I know, but
Okay.
it was an inpatient situation and they accused the mother of doing too many alternative things. This is, and the mother told me it was clearly a punitive because she got into it with this doctor, so it was a punitive thing. It's just unfortunate. I hate hearing this stuff. And I think I shared with everybody at Dustin's, one of Dustin's webinars that I had a child reported to Child Protective Services for using CBD and not being under a physician's recommendation. He was the
Really?
Yep, a sibling of one of my patients who I took care of who had cancer, who's in remission now for over 5 years. The parents know all about cannabis. They're better than anybody at understanding cannabis because they give it to their child who's still, recovering from cancer treatment. And the sibling has having some issues, some neuropsych issues, and they gave him CBD. He got a stomach flu, went into the hospital. The mother admitted giving him some CBD, and they drug tested him, came back positive for THC. They reported to Child Protective Services. And the diagnosis on discharge was cannabis intoxication. And the kid has only used, shaking your head and closing your eyes, cannabis intoxication and had a fever and vomiting. So, like completely disregarded the classic stomach flu that is basically what brings these kids into the ER. I'm not sure how he got fever and vomiting from a couple of doses of CBD.
Sheila, you're on mute. And
Yes.
Megan,
Okay,
you
so
wanted to speak.
hi. So yes, to build on what you were saying, Dale, about the taxation and about carving out medical and how that works and how to make it work. I think part of whatever comes through next year has to include that all people who take biology class know that we have an endocannabinoid system. Because currently, Dale, it is omitted from biology class. So we are graduating doctors and nurses and pharmacists and researchers at UC schools, at state schools, people in public education. If everybody knew we had an endocannabinoid system, they would understand how cannabis is medicine for so many different conditions. So someone who goes to a card mill doctor, let's say, for migraines, IBS, tendinitis, cramps, those are medical conditions. And that same person might also enjoy smoking a joint as well. But for those conditions, we need THC. So it's not like THC is not medicine. It is medicine. THC is also medicine.
And I tried to explain that. It's just really hard. I think you have to remember that there's people whose kids are getting wasted on these garbage products. Who
Yeah, that's
can't
different.
I know, but I'm just saying they can't seem to separate.
Right.
And now
But
the
for
gov-
next year,
yeah, yeah.
the
Oh,
next year and the taxation issue,
yeah.
as far as medicine goes and how to separate the people who are really there for medical reasons, bro, there's so many medical reasons
Well,
to
that's the
use
thing, is it's hard.
cannabis.
There are, if we're gonna call some products recreational and some products medical, remember, there is an overlap. So there's
Yeah.
many products that people take to get high that also work for migraines or whatever.
Exactly.
So
Well-
it's very difficult to label products one or the other. It's how you use the product
And
for what intention.
And
Exactly.
also, to take it a step further, according to the American Cannabis Nurses Association, the therapeutic use of cannabis is the use of cannabis products for medicinal, wellness, and healing purposes. It's personal and subjective to each consumer,
Yes.
with objective criteria being improvements in one of the 5 health domains: mental, emotional, physical, social, spiritual, without negatively impacting any of the others. So you're either using it appropriately or you're not.
I love that. That's great.
And one of my clients comes to me. I still maintain my nursing and my insurance licenses. I ran sales for Anthem Blue Cross for the County of San Diego, and I stay in touch with the broker community. I've spoken at Los Angeles Normal, San Diego Association of Health Underwriters, all of these broker groups, and clients are doing business with me at Bloom Hemp because they don't want to go to the dispensary. They're reticent to step into one of those shops. You know, 50, 60-year-old insurance brokers that are so thankful. And they started with broad spectrum, some of the THC phobic, but migrated over to full spectrum and need a milligram or 2 per day of THC. And they have to have the full spectrum markets to be able to get that. So, you know, there's so many sides of this conversation that we really need to attest to.
Yeah. Michael, you have to go. Take care.
Yes, thank
for
you. Let me know
attending.
what I can do to help. Bonnie, feel free to reach out to me. I'm happy to help in any way.
Thank you.
Thank you, Michael.
Thank you.
Thanks.
My dad with dementia needs 10 milligrams of THC 4 times a day. It is medical. Otherwise, he is impossible to manage at home. He has tremendous paranoia and severe PTSD from growing up in World War II Italy.
Yeah.
And instead of an antipsychotic, Dale, we use 10 milligrams of THC 4 times a day.
I mean, there's, right,
Yes.
and the medical, I don't think anybody here on this group is questioning the medical. I just think that the system lost its way somehow. And, Dale, Sherry and I were talking about this. I think you know about this. I think when they first passed Prop 64, there was supposed to be a medical committee set up as part of Prop 64. Do you know about that?
Well, I don't, no, it's not in the text of Prop 64.
Oh,
I didn't hear
okay.
about, no, there's no.
Okay. I thought, well,
Wasn't there-
maybe, yeah.
Wasn't
Sorry,
there also supposed to be the nonprofit model in
No,
Prop 64?
no, 64 specifically abandoned the nonprofit model. That was the
So-
big step in Prop 64. You can
Yeah,
go
huge
commercial.
problem. So wasn't there supposed to be, there was supposed to be a study group and a recommendation given like 2 years, within 2 years of enacting the law, that would be like the nonprofit model, like the collective model. so
Oh,
that
I think
those
I know what
people
you're
could-
talking about. There was supposed to be a study of that. by, I
Yes,
think, the
Dave knows.
DCC.
Dave, why don't you
The
unmute?
DCC was supposed to do the study, and I remember inquiring about it years ago because it was supposed to be done years ago, and it sort of reached a dead end. I think it just got dropped along the way amongst
It's time to revive that. Since we still pay 40% taxes, we should revive the things that were part of the law, right?
right. Well, there has to be a whole reinvigoration of the medical thing. Look, I got to thank you for calling this meeting. Actually, this is really helpful. Sorry, I've been behind the ball. With Cal Normal, this is not our bill, and sort of has not been at the front of our attention because we've got our own bills that we're getting through. AB 1610, the testing bill, lab testing bill, and the patient's free tax-free donation bill, which is up tomorrow in Sacramento.
Yes, it's up. It is. It is. Now that bill,
but-
everybody keeps telling me I need to sign up for those kinds of things, but I keep telling them that SB 34 events happen infrequently. It's not like I can just pop down to a dispensary and be like, hey, I'll take my SB 34 stuff today. It doesn't
It's
work like
something.
that.
No,
And my
but it's
husband
something.
takes 22,000 milligrams every month. So
Right.
this is very problematic.
Go ahead, Megan.
All right, thank you. I think we need to kind of like rein it in. It's getting late, and we need to figure out like what are the actionable steps we need to take like right now before tomorrow at noon. I also need to like bring up Ryan's law again, which prohibits nurses, current language prohibits nurses from giving cannabis products to facility patients, but does not prohibit hemp products. So that's where, you know, a 2, 3, 4 milligram THC gummy could be beneficial to a facility patient with the current language. So what can we do before, what do we need to do before tomorrow so we can all go to bed?
Well, you know, I haven't seen Bonnie's letter, but I was just going to send it around. But I would send a similar kind of letter to the through the legislative portal, and that'll get to the committee. You know, address it to the health committee.
The committee portal, I posted the committee portal in the chat there. Needs to be before a certain deadline. I think let's just do it midday. The committee portal, I just submitted again in the chat. I've done it multiple times, and that's how you get it straight to the health committee.
If you're a little late, they may still pay attention to it, but it won't get into the committee report. Will have a list of organizations in support, or you know, or in opposition and whatnot, and you miss the list if you don't get your letter in by the deadline. Is the way it works. But they will pay attention, and if you can't get a letter in, but you happen to be in the Sacramento area for the hearings, show up for that, and I will put in a word for. I'll see that Cal Normal puts in a word on this as well. Thank you for bringing all of these problems to my attention as well.
I was extremely concerned on May 6th when I learned about it. As you may recall, I had my hair on fire.
That's why we have those sessions, so that people know what's going on. Okay, so I got to go, but thanks. It's good to see all you folks, and
Thank
we'll keep working on it.
Thank you
Thanks
for coming, Dale.
Dale.
Thank you. All right, good night.
Thank you,
All
Elizabeth.
good, everybody.
Thank you,
for
Bonnie.
setting this
Thank you,
up.
Bonnie.
Yeah.
Bonnie,
Yeah.
are you going to submit the petition with what it is for right now
Um,
in the legislature, in the
I'm
health
having a
portal?
problem. I registered on the website. It's now saying it doesn't recognize my name or my email or my password. I'm trying to re-up, and now it's when I go in and re-up and put my name, it says there already exists. I'm like going in that death spiral of websites that don't want to let you in. So I'm going to try to figure it out.
You're talking about the change.org website or the legislative
No,
portal?
the Senate Committee on Health portal.
Oh my God.
I can't seem to get in, although there is an email, a direct email. So I think I'll just send my letter to the direct email.
Yeah. Also, we have the, I'll send you
Here's
the,
here's the direct email.
the legislative aide that is working on this for the chairman, the chair of that committee.
Who's that?
Right. I'll look it up. I sent it earlier in the
Eureka?
what's. No,
Richard
it's
Roth.
Devin. Vince Marchand. Here, I'll copy it.
And who is he?
He is the aide to Senator Roth,
Oh,
who
okay.
is working on this bill. Senator Roth is and his office does have concerns about the bill the same way we do. So let me just put it in the chat here. There is the young staffer's personal email, not personal, but the staffer's email. So
That's
I would
great.
send it to both.
Yep.
I'm sending it everywhere. Thank God Dave is helping me because on my phone, it's very hard. So thank you, Dave. And
Okay.
thank you everybody for showing up and being here and doing all these things, and Bonnie for launching that petition and getting some media to this. I'm so heartened by
I
all
reached
of your
out.
participation.
I have a New York Times contact. I have the LA Times, she answered. Washington Post didn't answer me. New York Times didn't answer me, just ghosted me. And also a Northern California did reach out, but then I haven't heard anything. So it's
Wow.
really.
What about local news stations like Channel 4, 6, 2, 5, all of those, the action alerts? Because I don't usually watch the news, but I was with my sister and she watches it all the time. And
That's not a bad
somebody
idea.
called.
Yeah,
Yeah,
that's
call
not a
all
bad
the tip
idea.
lines.
One of the
Yeah,
things that
call
we
all
can
the
do too as well is we'll put this up on YouTube and give you guys all the link. And so this can be distributed along with our message.
Yeah, this conversation.
This
'cause it's
conversation.
recorded. And then also, we can also, Sherry's got a podcast, the Green Nurse Podcast, four-time award winning. We can host a StreamYard event and be live at any time you want to do that, and stream it to all the social media platforms at the same time. And we can do that repeatedly.
And we got syndicated on Red Coral Universe. So we're being seen over by 500,000 people. So we can take this and put that up there as well with a call to action.
Yeah. I think
We have
that
time.
Yeah,
Sorry.
again, I just want to say that I do think that they're trying, but again, I have concerns that maybe it's too little, too late. I don't know,
I think they're trying, but unfortunately, like the CCIA just wants our money, and also the politicians want our money. So if CBD goes into a dispensary, it gets taxed out of oblivion, and they get their piece, and patients get screwed. And so this is my big concern, and so
Well,
that's why I'm like, no.
We just have to keep trying and make sure that
Yes.
we put our,
Yes.
everybody just do the best they can to get a letter in
Yes.
and to, make your voice heard.
And during the recess is when we can really push on the media. Luckily, there's a recess. We have a 4-week window from July 4th to August 4th to get more stuff in the local news cycle and more constituents and voters to write or talk to their legislators, or at least be upset about it,
Yeah.
So
All
right on.
All right. Thank you, everybody.
Okay. Brush up your
Thank you so
notes.
much.
Thank you, everybody.
Thank you. God bless. We'll talk soon.
Take care. Bye.